A 3-year-old boy is brought to the emergency department for a 1-day history of fever, headache, and mucorigidity. A lumbar puncture is performed, showing the following. Opening pressure is 170, glucose is 30, proteins is 120. Which of the following best describes the most likely cause of this patient's condition? Choice A, exhibits complete hemolysis on blood agar. Choice B, infection via dental caries. Choice C, is sensitive to optogen. Choice D, spreads hematogenously via break in skin. Choice E, exposure via unpasteurized products and deli meats. Or choice F, single-stranded positive sense RNA virus. I'll wait 5 seconds and answer your question. So, handing you the diagnosis of meningitis and basically just a microbiology question, combined with you being able to read the CSF report and some basic epi. So first we have this pretty high opening pressure. That alone is non-specific, but we have low glucose and high protein. So right off the bat, you can immediately dismiss viral meningitis because glucose would be normal in a viral meningitis because they don't undergo metabolism. So they wouldn't be consuming the glucose. Now, if this is all I gave you, then you could already narrow it down to bacterial and fungal. Now, I didn't put any answer choices here that correspond to fungal infections, but even without that, fungal meningitis is pretty rare in a 3-year-old boy who otherwise doesn't have some kind of problem with his immune system. Typically for fungal meningitis, you want to be thinking immunocompromised, especially HIV patients. Obviously, you can get stuff like cryptococcal meningitis. In some cases, you can get candidal meningitis in newborns, but obviously this isn't a newborn. So we're on bacterial here. So here's the basic rules. If you're suspecting bacterial meningitis and you have a newborn, so about less than 2 months of age, you want to go with group B strep or strep agalactiae. If they're older than that, the most common you default to is strep pneumonia. The big exceptions to this on step 1 are usually kids to teens, like age 5 to 17 or something. If they are in close quarters, like college dorms, military barracks, camps, that would be your Neisseria meningitidis or meningococcus. You have the unvaccinated kids, where you would be thinking Haemophilus influenza type B. And then finally, in the immunocompromised and the really old, you want to think Listeria. Now, I'll expand on these in a little bit because I put a lot of these as the wrong answer choices anyway, but first, the correct answer. I didn't really give you any qualifiers here, so you default to strep pneumo. Some of you might think, well, this is a 3-year-old, so isn't meningococcus also possible? Yes, but number one, I didn't really give you any clues in the question that hint you at meningococcus, so I would personally default to strep pneumo in that case. And number two, none of the answer choices I listed correspond to pneumococcus anyway. And the only thing that's left after that is for you to know your micro stuff, right? Strep pneumo is alpha hemolytic, optogen sensitive, gram-positive diplococci, so choice C is sensitive to optogen is the correct answer. Now, I've said this many times before. Yes, I know the micro stuff is very annoying and everybody hates it. It's pretty much one of those things where you gotta have an algorithm or a cheat sheet that you have down on a piece of paper and you take it out a couple times a day or whatever and you look over it. You recite it to yourself, maybe you quiz yourself on a couple things, and then you move on to doing other questions, and then you do that for several days until you memorize it. I mean, if you're in a rush, you can try to hard memorize it, or maybe you're one of those brilliant gunners that memorizes things immediately. But if you were, you probably wouldn't be on this channel, right? So anyway, let's just look at the other answer choices here. Choice A exhibits complete hemolysis on blood agar. Now, this is of course referring to the beta hemolytic organisms. When we're talking about separating out the catalase negative gram-positive cocci, you have the alpha hemolytics, partial hemolysis, green zone on blood agar. Those are your strep pneumo, like this question, and viridans. Once again, choice A, complete hemolysis on blood agar, is beta hemolytic. This is referring to group A strep and group B strep, which is strep pyogenes, which is bacitration sensitive, and your strep agalactiae, group B strep, which is bacitration resistant. And just for completeness sake, we also have gamma hemolytic, which is no hemolysis on blood agar, and those are your enterococcus and your strep bovis. Enterococcus doesn't show up that often. Sometimes it's a bug that causes UTIs and some nosocomial infections. Strep bovis / strep galolyticus is also pretty low yield. There's some fun fact where it's associated with colon cancer, which I think has come up in like 1 or 2 questions across all of NBME. Anyway, I know I'm giving you a lot here, but I'm trying to be complete. So coming back to choice A, where we're talking about the beta hemolytic group A strep or strep pyogenes, it's not really relevant in most meningitis questions, but group B strep, like I mentioned earlier, is notable because it's a cause of meningitis in infants under about 2 months old. It's also why we treat group B strep in pregnant women. Choice B, infection via dental caries. This is referring to strep viridans, which includes strep sanguinis and strep mutans. It's similar to strep pneumo in that it's also alpha hemolytic, but is optogen resistant instead of optogen sensitive. The fact that it comes from dental caries is like just one of the most popular things that comes up about viridans, and it can cause endocarditis as a result. Meningitis is not typical. Choice D spreads hematogeneously via breaking skin. This is pretty much just referring to your standard Staph aureus. Catalase positive, coagulase positive, gram-positive cocci in clusters. Obviously, there's a ton we can talk about with just staph. I mean, mainly you would be thinking skin infections, but of course, just stuff like toxic shock syndrome. You get those really popular questions where a kid had to pack a nosebleed or women left their tampon in. And of course, it'll have superantigen, which cross-links T-cell receptor with MHC class 2 molecules. Huge release of cytokines like TNF alpha and IL-1. There's your immunoconnection. Obviously, we don't want to be stuck here all day talking about Staph aureus, so let's move on. Choice C exposure via unpasteurized products and deli meats. This is listeria. You want to know that it's intracellular, and it is a gram-positive rod, not a coccus. So that's actually one way they can try to test you about listeria specifically for meningitis, even without an immunocompromised patient. I mean, they usually will give you an immunocompromised or elderly patient anyway, but maybe they won't go out of their way to draw attention to it, but they'll specifically tell you that there's a gram-positive rod found, and then you would know it's listeria. So unpasteurized dairy, deli meats is a huge association. It can also be transmitted vertically, so it can happen in neonates. Finally, choice F, single-stranded positive sense RNA virus. I mean, ours already mentioned. The CSF findings here do not suggest a viral meningitis at all, so you should have eliminated this one out of all of them, if anything. Like I said, you want to know about viral meningitis. Has normal glucose, and it can have normal or elevated protein. And if they don't tell you any specific details, but you know it's a viral meningitis, you would want to default to enteroviruses or echovirus specifically. That's the most common viral cause of meningitis. The other one that comes up fairly often because it's kind of unique is if you see blood in the CSF, then you want to be thinking herpes, because herpes likes to damage the temporal lobe and it will cause bleeding. Although obviously herpes wouldn't apply to choice F here because herpes is a DNA virus, right? So bring it back, like I said, you want to be able to identify a lot about meningitis just off the CSF report. Now the vignette is usually going to give you a lot of other clues as to the specific etiology, but like I said, know your basic rules. If they're a neonate, group B strep. If they're older than a neonate, over 2 months, default to strep pneumo. If they're a child to teen and they're in close quarters, like a college dorm or barracks, you're going to go to meningococcus. If they're unvaccinated, you go to H flu type B. And if they're immunocompromised or really, really old, you might be thinking listeria. And that's for bacterial meningitis, of course. Hope you found this video helpful. I'll see you in the next one.